Hello everyone, in the current session we will be discussing about modifier 54, 55, 56 and 57 along with clinical examples. Before going into the modifiers, let us first discuss about the various services that are included in medical procedures. All medical procedures that include a global period are comprised of three parts: preoperative services, intraoperative services. Example, performance of the actual surgery or procedure, and post-operative care. Post-operative care includes related follow-up visits during the 10 or 90 days global period. We will discuss in separate session regarding the global period, and according to global period, surgeries are categorized into minor and major. Major surgeries will have 90-day global period, whereas minor surgeries will have 0 or 10 days global period. And if the physician does not perform all three parts, as we have discussed earlier, medical procedures, they comprise of three parts: preoperative services, intraoperative services and post-operative care. And if the physician does not perform all these three parts of the service, complaint coding dictates that you append modifier 54 for surgical care only, modifier 55 for post-operative management only, and modifier 56 for preoperative management only. So first we'll discuss about modifier 54, that is surgical care only. When one physician or other qualified healthcare professional performs a surgical procedure and another provides preoperative and or post-operative management, surgical services may be indicated by adding 54 modifier to the usual procedure number. If one surgeon is performing only surgery and another physician will manage the preoperative and or post-operative management, then the surgery procedure code CPT should be appended with 54 modifier to indicate surgical care only. That is, the physician performed only surgical care, and pre and post-operative managements are performed by another physician. Let us see an example. An orthopedic surgeon performs an open tibial shaft fracture. The CPT code is 27759, but relinquishes the care to another physician for post-operative care. Here the surgeon is performing only surgery, whereas post-operative care is taken care by another physician. So the surgeon should append 54 modifier along with the procedure code, that is 27759 along with 54 modifier. 27759 is nothing but treatment of tibial shaft fracture with or without fibular fracture by intramedullary implant with or without interlocking screws. So 54 modifier means surgical care only. Now coming to 55 modifier, this indicates post-operative management only. Previously it was surgical care only, whereas 55 modifier, it indicates post-operative management only. When one physician or other qualified healthcare professional performs the post-operative management and another performed the surgical procedure, then the post-operative component may be identified by adding 55 modifier to the usual procedure code. Let us see an extension of the previous example only. As we have discussed earlier, an orthopedic surgeon performs an open tibial shaft fracture and bills the surgery with 54 modifier, and partial post-operative care is provided by the surgeon. That is, surgeon is providing partial post-operative care for the initial 45 days and then turned over to another physician for the remaining 45 days. So here the surgeon is partially performing the post-operative care and passing on the post-operative care to another physician. Here surgeon can build two modifiers, 27759, which is nothing but the CPT, along with 54 modifier to indicate surgical care only, and similarly 27759 for the period of 10th March to April 23rd. He can append 55 modifier to indicate partial post-operative care from April 24th to June 7th. The second physician should append 55 modifier along with the CPT. 27759 with 55 modifier to indicate post-operative management only. Let us suppose the surgery has been performed on March 10th. So for initial 45 days, surgeon will bill post-operative care, and the remaining 45 days, another physician will bill the post-operative care. Now coming to 56 modifier, which indicates preoperative management only. When one physician or other qualified healthcare professional performs the preoperative care and evaluation, and another performs the surgical procedure, then the preoperative component may be identified by adding 56 modifier to the usual procedure code. Let us see an example. If an abdominal surgery is planned for a patient with underlying heart disease, then the surgeon may wish to have patient's cardiologist examine the patient and give a patient preoperative clearance. In this instance, the surgeon will still do the routine preoperative care and the cardiologist will bill an established patient office visit. And the surgeon, to include his routine preoperative care, he can append 56 modifier. But the cardiologist would not bill the surgical code with 56 modifier. Only the surgeon will bill the surgical code with 56 modifier. Whereas cardiologist should bill an established patient office visit. Now coming to the important points where 54, 55, 56 modifiers are not considered. Modifier 54, 55 and 56 are not considered valid for obstetric care procedures, as specific codes already exist to identify that more than one physician provides antepartum, delivery and postpartum care. Next point is modifier 54, 55 and 56 do not apply to procedure codes with 0-day post-operative period. And modifier 54, 55 and 56 are not considered valid for E&M service, anesthesia, radiology, laboratory, medicine and ambulatory procedure codes or any non-surgical HCPCS codes. And they are also not considered valid for provider types to which global surgery concept and a post-operative care global period do not apply. For example, assistant surgeons, ambulatory surgery centers, outpatient hospitals and inpatient hospitals. These are some of the important scenarios where 54, 55 and 56 modifiers are not considered. Now coming to 57 modifier, which indicates decision for surgery. An evaluation and management service that resulted in the initial decision to perform the surgery may be identified by adding 57 modifier to the appropriate level of E&M service. Whenever a decision for surgery has been taken in a routine E&M service, then you can append 57 modifier. Let us see an example. A patient presents to emergency department, ED, with abdominal pain and fever. The consulting surgeon documents a level 3 outpatient consult and decides at the visit to perform an emergency appendectomy. So here the appropriate coding would be 93243 along with 57 modifier. This is a consult code, outpatient consult code along with 57 modifier and appendectomy procedure code 44950. 99243 is outpatient office consultation code of moderate complexity. Here 57 modifier is indicated to indicate decision for surgery because decision for appendectomy has been taken. Followed by appendectomy code 44950. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.